Hi, I'm Dr. Gwen. I'm a clinical psychologist who's been empowering disabled and neurodivergent individuals, their families, and their support systems for over 20 years. If you haven't already, please consider subscribing to my channel, where I curate tools, share mindsets, and promote habits to help the neurodiverse community thrive. I'm so excited to be trying something new on the channel, and we'll be doing a sex and relationships series with Dr. Jamie Barstein. In this episode, we explore sex education and what must be considered to make it meaningful, understandable, and practical for neurodivergent individuals. Make sure you hit that notification bell so that you don't miss our next episode on dating. Enjoy. Hi, Jamie. Welcome to the channel. Thanks so much for being here.
Hi, I'm so excited to be here. Thank you.
We have a lot to talk about today.
Yes, we do.
Yeah, it's the S word, which I mean sex. And we'll talk about that. But first, before we get into that juicy stuff, let's have you tell us who you are so that the audience can get to know you.
Dr. Jamie Barstein, I'm a licensed clinical psychologist here in the Los Angeles area. Somewhat new to Los Angeles, actually. I've only been here, it's been 3 years now, so maybe that's not super new. But I did my graduate training at Northwestern in Chicago. And while I was there, I trained with someone named Dr. Rachel Lofton, who's really an expert in sex and sexuality for individuals on the spectrum. I'm trained as a child and adolescent psychologist, but she was working with young adults. And so I just kind of got like hooked with her and hooked with this population. And then, ended up a few other places, and then at the help group in Los Angeles, where I've been able to start some sex education programs for young adults with autism. I have interest in training in lots of other things like anxiety and autism. Neurodevelopmental disabilities is really my jam, both assessment and treatment. But I've always just kind of loved working with this adolescent young adult population, and just seen such a need in addressing sex and sexuality and gender and all of these different identities. And so I've kind of gotten pulled back into that work, which is really exciting too. So I'm now a full-time psychologist at the help group, and it's one of the many things I do, but I'm really passionate about it.
Yeah, and that, talking about sex is hard like as it is,
Yes.
right?
Yes.
That there is it's like taboo, and it's like almost shameful, to talk about it. And we've got this population of young people who are physically maturing,
Mhm, mhm,
as everyone does, and really need these concepts broken down so that
mhm.
they understand them. And, I would agree with you. I think that, because I only work with individuals who are 16 and over, and with most of my clients being in their 20s and 30s, right? Sex is a big thing that comes up because
Yeah.
there's a desire for relationships. There's a desire to have sex.
Mhm.
But we don't fully understand what it's all about, how to have it, really the details of it. And what I find sometimes is one, there's not a lot of programming for this age group in general,
Right. Right.
right? It's like all of a sudden services fall off the cliff, like at 18, 20. I don't like nothing magical happens, but here we
Yeah.
go. And I think part of it is because there's not like a logical progression after high school. So,
Yeah.
when kids are in school, like school age kids, you go to from second to third to fourth. Like you kind of know what's happening. We really, I think, really get what kinds of interventions are helpful, necessary now for early
Mhm.
intervention. But man, the choices post high school are incredibly different.
Yeah.
So it's
Even for
much
the
needed.
neurotypical population, I think, I mean,
Yeah.
I identify neurotypical and had neurotypical peers, and like that transition out of high school or even out of college was really tough. Like
Yeah.
there's less structure. What do we do next? So for sure, I
Yes.
mean, and then add on having social difficulty, I think it just makes it even harder.
Yeah, and it's a vulnerable age.
Mhm.
This age period is really vulnerable. It's a vulnerable
Mm.
time.
Yeah.
And so identity, who am I?
Mhm.
Really does come into play. And, the one commonality with all of the adults that I work with is they desire and wish and hope for a relationship.
Yeah.
I
Yeah.
mean, it's very clear to me that it doesn't matter who I'm working with. That's part of the human condition to
Mhm.
be connected, to have intimacy, to
Mhm.
belong. So I love this. Now, Jamie, maybe what we can do is really get into how you approach sex ed with the neurodiverse population,
Yeah.
because what I've seen is some kind of flyby didactic curriculums,
Mhm.
and then my clients come away with that with a lot of misunderstanding.
Mhm. Yeah.
And that misunderstanding then makes their parents nervous.
Yeah.
And
Yeah.
then, it's like, and then like fear leads to hate, hate leads to anger, like
Yeah.
here we go.
Yeah.
So maybe you can talk to us about the way that you approach these types of classes and what you kind of consider.
Sure, sure. I think that's a really important question. I think first of all, I always kind of start this talk by saying, like, where do we learn? If you had to think, Gwen, like, where did you learn the majority of the information that you know about sex? Where did you learn it? Was it in your sex education health class in high school? Was it maybe from a parent, or was it from your
Friends,
peers? Right,
peers.
right. I always say summer camp. Like
Yeah. Yeah.
that's like where I learned everything. I
Yeah.
came
Yeah.
every summer and was like, what's this mean? And that's where I learned the information. So thinking about, like, yes, we could take a course, but or we had sex education depending on where you went to school, and maybe you learned like some of the basic anatomy, and this is how you get pregnant, or this is kind of how it works. But really, like, the information that we really learn is from our peers.
Mhm.
And if you don't have a supportive peer group, you're missing that information. Or if you're misunderstanding social information, imagine how much you're misunderstanding around sex. I mean, it's confusing and complicated, and there's no one way to do it or right way to do it. And so that's just an important thing that I always kind of just like take a step back and think about. That is, when we're working with this population of individuals, who have autism, first of all, they might be missing that peer group or misunderstanding what's happening in relation to this topic. Also, a lot of individuals who are in special education, even if they're just receiving some remedial classes, they actually opt out of sex education. So for some
Okay.
adolescents and young adults, they've actually never even received sex education anywhere. And I appreciate what you said about it's taboo. It makes me think, even the group we're running now, when we were sending out a marketing email about it, we had sex in the subject line and it bounced back. And it was like, is this spam? Like, is this something inappropriate? So just thinking, like, even just the word sex has like so much taboo and stigma, and whose job is it? And,
Yeah.
to teach this, and who talks about it. So, we try to consider that in our treatment approach. And so factors like, when we're talking about sex in a group, or, encouraging clinicians or parents to talk about sex with their young adults or adolescents, yes, it's the details for sure. It's the right education, and not just the medical terms. It's
Mhm.
what you're going to hear in the media. It's
Mhm.
what you're going to hear in your peer groups, at school, at work, on TikTok. There's like a whole new thing now. It's what does that mean when you hear these things, and then it's also incorporating the social component too. So, you know, sex is not just someone throwing up a picture. I think of like a old school sex education class where the woman's like, here's the penis and here's
Yeah.
the vagina. Like, it's
Yep.
not just that. There's such a social component to this as well.
Yeah.
And so it's really identifying, not just let's educate around the anatomy piece and like the legal pieces of this, who
Mhm.
can and who can't you have sex with, or any sexual relationships with, but also like, what's the social component of this? If someone
Mhm.
reacts to you in this way, what could that mean? If you are interested in dating someone, like, how do you even go about that? And really incorporating, theory of mind. So perspective taking, that's a huge part of dating. I mean, does this person like me? Have I gone too far? Can I text them again? Like these are all just components that are really important to work with as well. And so we're making sure, we're not just teaching this in a way that's like, now you could take a test and you could get all the answers right about like true or false or what is this body part, but also that you're actually understanding the applicability of this within a relationship and within an interaction with someone.
Yeah, I mean, it's this very dynamic integrative process, right?
Yeah.
And I think the idea this concept of overlaying or the importance of the social piece
Hmm.
is so critical when our population that we work with primarily have social difficulties. And that so much regarding touch. I mean, even I think about sensory kinds of issues,
Absolutely.
right? That now come into play, and that this idea. You're so right. You were talking about it's not just anatomy.
Mhm.
It's not like the anatomy and the mechanics, right? It like that's not. It's really beyond that. And I think that what makes this topic so challenging is that so many of the clients that I work with lack a deep self knowledge
Mhm.
of who they are. So that inevitably affects and impacts who I like, who
Mhm.
I'm consciously maybe trying to pursue or date. What does that even look like? What are the steps to that? You're right. Should I text again? How many texts are
Mhm.
too much? What and short of a circle of friends idea where we're talking about, okay, well, what circle is this person in? How much time have you spent with them?
Right.
How do they progress into the inner circles? Just to even understand when touch is appropriate. You know,
Absolutely.
these ti
Yeah.
this has gotta be part of this curriculum. It just can't, like I said, a fly-by anatomy mechanics curriculum is really not gonna hit the deep layers of this very dynamic kind of idea.
Exactly. And I appreciate
Yeah,
you bringing that up about identity too. So,
yeah,
one of the things that we really make sure to work on is figuring out your identity. And actually, in the group that I'm currently running a young adult sex education group, and there was this really rich discussion around um, neurodiversity and as a kind of spectrum and differences in terms of preferences, but also just sexuality and sexual experiences in general of
yeah.
having such a spectrum. And so I really love this conversation that a few of the adults were having about, I've always wondered, like, is this different for me because I'm on the spectrum, or is this different for me because it's just different for me? Because interests and sexual preferences are different for everyone. There's no like one way or right way. And so I appreciate you bringing that up about identity. I mean, a part of this is also exploring who you are and what you like as well. We know that individuals with autism also often identify as either gender or sexual minority. We have a huge population who identifies as asexual. And what does that mean for them? And, I've heard people who say, well, I'm emotionally attracted and kind of romantically, but maybe not sexually interested. And for things like sensory reasons or
Mhm.
just, not feeling comfortable being so physically close to someone. And what does that look like? Like, how do you, I mean, a lot of people say, I didn't even realize that was something that I could identify with. Like,
Yeah.
I knew that's how I felt, but I didn't know it was okay. I always thought I was either supposed to be, find a partner this way or this way, either a man or a woman or no partner. And so there's just it is very dynamic. Like there's such diversity even just within sexual preferences.
Yeah, well, and that, and here's another thing that I think can be a barrier to a deeper kind of understanding, which is a cognitive, a rigidity in a cognitive style or a black and white thinker, right?
Mhm.
If these are my only two options of identity,
Mhm.
and I really don't fit, and I don't fit that.
Yeah.
And maybe it's because I haven't had the experiences
Mhm.
to in relationships before,
Mhm.
and
Mhm.
that's something that I need to figure out and try,
Mhm.
and that's another thing with this population. Experience matters. Experience is the best teacher, not
Yeah.
these theoretical conversations. about a hierarchy of how you date
Right,
someone,
right,
right?
right.
But what does that even mean? And so you're right, though, like going back to this, that so many special ed students opt out of the sex ed curriculum or the health curriculum. I mean, I will say most of my clients have have not taken a sex ed class in high school. It leaves them to find one after high school. So
Mhm,
like one your class, for example, or even like a
mhm.
Foothill Autism Alliance does these workshops as well.
Yeah,
That's their first interactions with learning about sex,
mhm.
right? Um, and so what does that even mean? Even down to things like masturbation.
Yeah,
And that, or a wet dream and being scared.
yeah, yeah.
These are things that, my clients are experiencing. And for me, it's like, how do we reduce the shame?
Mhm,
Not only for the client, but their whole system.
mhm.
How do we talk about this freely? How do we dialogue about this?
Yeah,
Because when shame's involved with anything, it really does shut down a desire for understanding and for connection
yeah,
with others. And that's what I think is at the heart of this.
yeah.
So, Jamie, when you are um, putting together, so there's this very rich part of your groups, which is that the group members themselves are bringing in this process and
Mhm,
dynamism in a very cool peer to peer
mhm.
way. It's so normalizing, and it makes it okay in this very safe space. So
Yeah,
that's like so great. How do you consider the comprehension
mhm.
of, the even like kind of going back to anatomy or vocabulary words, this kind of idea? Like, do you find yourself needing to do any kind of tweaks about how to understand some of these concepts?
Yeah, definitely. It's interesting because autism is such a spectrum, and so we might have folks coming in with kind of different experiences, different levels of knowledge. And so I will say that the groups that I run have really been for individuals who have average to above average IQ and also language abilities. We actually are talking about adapting to more developmentally delayed mild intellectual disability, which I think would be really important.
Yeah.
And I should also say that the group we're running right now is in collaboration with Dr. Eileen Crehan, who's at Tufts University, and she and I also overlapped in Chicago. And so now she's at Tufts, and I'm out in LA, and she's been adapting this curriculum. It was originally developed in the Netherlands by Kirsten Besser and colleagues, and it was for the adolescent population. And so we're all just kind of figuring out, how can we make this work? Because you're right, a lot of the curriculums that exist they're either kind of surface level or they're like just the anatomy without the social component. And so this is a pretty detailed curriculum. So we're using it and kind of adapting it. Um, but it is, I mean, we have to, you know, we our what we do is we start with the basics to try to make sure everyone's on the same page. So some of this is going to, we'll say some of this is going to be things that you learned forever ago. And some of our individuals are like, I could, I'm so good at anatomy, I could pass this test without ever, needing to learn it again. But making sure that we just start out on a basic level of like, let's make sure we all just know like what are body parts of someone, male, female, intersex, like what does that look like? And then really, part of it is working with families too and parents if they're involved to kind of assess like what are their concerns, what behaviors have they seen that maybe are concerning, just to try to figure out like how can we also tailor the group so that we're meeting the group needs but we're also meeting individual needs, which I think is a challenge for a lot of the different groups that we run, but really making sure that you know we're hitting some of that like higher level stuff around the social components, but then we're also making sure that people are understanding just like the basic rules too. I mean, when I always think safety for a lot of these guys, I mean, that's why a lot of families come to us too. Unfortunately, the rate of being a victim and also a perpetrator of sexual crimes is really astounding for individuals with autism. And so part of this is also like, there are certain things that are rules and are laws, and we have to make sure that that's understood at a
Yes.
concrete level.
Yes.
That, who you can and can't have sex with, where you can and can't have sex, where you can and can't touch yourself, masturbate,
Yep.
those are all really important things. And so we do a lot of checks for understanding, but really making sure that everyone's at least getting those basic concepts, knowing that some of the more social components, some people, it might be an ongoing process for some of the individuals in the group.
Yeah. Oh, yeah, totally. I love that focus on safety because I will say
Yeah.
that is such a big motivation and
Hmm.
that's actually very concrete. And that can be
Yeah.
concrete because there are laws, right? It's like
Yeah.
that those are black and white. So we understand those and that how often do individuals who don't fully understand this get caught up in
Yeah.
something unintentional that leads to a sexual offense at a level
Hmm.
1 or 2 level
Hmm.
and that's serious,
Yeah. And they're over 18
I
and
know
they're, yeah, convicted. I mean,
they're
it really is. Yeah.
it's serious, right?
Mhm.
I want to go back to this piece here that I think is oftentimes really missing, which is back to the family
Mhm.
and back to parents.
Sure.
Our clients live at home longer,
Yeah.
right? They need more time. They need more support. Um, and so oftentimes they are living at home and without doing a check with about family values, about the family's comfort level with talking about sex or
Mhm.
masturbation
Mhm.
or gender or sexual identity, preferences, right? It's hard because we want to bring these conversations back into the home.
Yeah. Yeah.
And so while it's phenomenal to have that really safe space to do it, in your groups with peers, because I think that is so beneficial, especially developmentally,
Yeah,
right?
definitely.
But to really go back because the family is where, and the parents, right? That family context is where this individual goes back and lives, I mean, figuratively and literally.
Mhm. Yeah.
And so that's so great. How do you guys incorporate, or how do you incorporate parents into these groups?
Yeah,
And
I
still
mean,
respecting, obviously, the adults that you're working with, but
right, and I'm thinking about it not just in terms of the group, but also in the individual work that I do. You're right that so often the young adults we're working with are still living in their parents' home, or they're living in their parents' home maybe longer. And so part of this is definitely like understanding, and even with an adolescent, right? So it's understanding like, what are the family's expectations? What is the culture around this? But also really educating parents and educating the family that the physical maturation of someone with autism is the same as someone without, right? So that means the desire to masturbate, the occurrence of puberty, of wet dreams, these are all things that are going to happen, but they might be more confusing, or like I said earlier, they don't have access to maybe that group to be able to figure out like, hey, is this normal? What's going on?
right.
And so the biggest thing that I talk to families about, first of all, I'm very upfront about the fact that like I'm not going to tell that my clients or the participants in the group like, here's what you need to do.
Right.
But I'm also not going to say that abstinence is the answer, because I really want to provide that my approach. And if a family or an individual chooses not to work with me, but my approach is really, I want to give you all the information so that whatever you choose to explore, you're doing it in a safe way. So that if this feels like something you'd like to try and you do it in a way that's unsafe, that's when you get in trouble. And so I always talk to parents about the most important thing that they can do, and you mentioned this word of shame, is not shame their child, right? And so yes, if a child is living, or a young adult is living in the parent's home, they can't, no one should be masturbating in the living room, right? Like
Mhm.
that's inappropriate. It makes other people uncomfortable. But if they need a special time and place to do it, like let's honor that and allow it. Because otherwise my fear is they're going to go masturbate at school, right? Or um, at the library,
Yep.
I mean, and that's when you get in trouble. And so really trying to build in with parents is that I know this is uncomfortable to talk about, but the most important thing is that if your child or your young adult comes to you with questions, that you're open and that you maybe say to them, like, this is really hard for me to talk about. I feel really uncomfortable with this. I say that all the time. I say, like, I feel more comfortable because I've been using these words longer, but like, yeah, it's really weird for me.
Yeah.
A lot of my clients are males and I'm a female.
Yes.
And for me to use some of these terms, I'm like, I know it's strange to say it with me. So parents to be honest about that too, like this is strange and it can be uncomfortable, but also, wouldn't you rather them ask you the question or talk to you about something and get the right information than go online or go to TikTok is like on my mind right now, or go to TikTok or wherever it is, and then get the wrong information and misunderstand it. And so I think parents do have an important role here, but the biggest thing, it might not be that their role is to educate the individual. Maybe they find someone else because it really is hard for the client to open up to the parent, but at least to provide a space that feels comfortable and not shaming,
Yep.
so that they can feel like this is okay, it's normal, rather than something's wrong with me,
Yep.
or what is this that's happening to me.
Yep. Yep. The word that comes to my mind in this is competence.
Hmm.
And this idea of trusting that our young adults that we work with are competent
Hmm.
to make these decisions.
Yeah, exactly.
Not saying without support or guidance or
Right.
consult, but that I think what happens, and I see this in transition a lot because I feel like as I'm helping teens transition to adulthood, one of the hardest things that I see and experience as a therapist myself is how do I help the parent healthily separate
Yes.
from their young adult
Yes.
child? And I get it. Parents have established this incredible accommodation system that's reflexive.
Mm.
I mean, they don't even think about it, right? It's like they are superheroes in this. I mean, like,
Mhm.
and so they do and do and do. It's kind of like the one-on-one aid in school. And we never
Mhm.
like in high school thought to say, well, what is the one-on-one aid doing? And what kind of responsibilities and skills are we going to give back to the student so that by the time we're in our senior year, we can take our own notes or we can, I don't know, plan our own assignments.
Right,
Now I
right.
get it, like maybe they tried. Okay, well, that's good. If you actually tried, then we know that we need a compensatory system, not continue to throw
Right.
intervention at it. But if we didn't try, then you don't know. And
Mhm.
now we're going to face plant into adulthood, like, hard, right?
Right,
But
right.
it's like this idea of like, if a parent is always accommodating, um, the responsibility never got passed on to the young adult. And then the
Mhm.
parent doesn't see that young adult do the things that they want them to be doing.
Right,
And
right.
so now they don't trust that they can when maybe they didn't have the opportunity for that. And I'm not saying this is not like, I mean, this is obviously very complex. And I see this as a real survival, and this desire for thriving
Yeah.
of our young people. But I see this even in this realm, where now my young adults that I work with don't really want to talk to their parents about masturbation, but they are confused.
Mhm. Mhm.
Or there is messaging that they really interpret as what they're doing to be shameful.
Mhm.
And so it really shuts it down. And now we're in chat rooms.
Yes.
And it's driving kind of they're finding their own voice and competence in other arenas that are not supervised,
Mhm.
that are potentially filled with people who have bad intentions.
Mhm.
Right, and this is
Or
where we're getting into some trouble, is we're getting into this kind of sneaky behavior. So I say to parents all the time, emotions go somewhere and they always have to go somewhere. If they're
right.
not gonna go to you and they're not gonna be acknowledged and felt and understood in this dynamic, um, they will go somewhere else. So, do
Yeah.
you see that? I mean, I see that myself
Yeah,
clinically,
I
but
I do. It's also making me think. I mean, the parents that we work with, yes, they are superheroes.
They're
I mean,
superheroes.
incredible. And
Yeah.
I do often, I'm sure for you as well, I often see families who will come to me because their young adult is like not as independent as they want to be and as the parents want them to be. And I think part of that is parents feel this um, need to protect, right? I mean, the reality is that their child does have
Yep.
difficulties, and unfortunately maybe has been bullied or
Mhm.
needed extra support. And so I appreciate this concept of like competence and providing the young adult with the knowledge to be able to be competent and independent, while also parents are acknowledging that they also there is like a level of
Yeah.
protection that they need to provide their child. And so, one of the things people ask is, it makes me think, is like, well, when should I start talking about things like
Yeah.
sex? And I even have talked to parents who say, like, I don't think they're ready. They're just still so immature socially. And I just kind of remind them, like, what we don't want to happen is then they're 25 years old and they kind of missed all this opportunity, because the reality is, like I said, the physical maturation is the same. So they are experiencing the same physical feeling sensations. Yes, you're right that there might be a mismatch in kind of the social versus the physical components. But to me, that means it's even more important to teach
Mhm.
it early. And maybe
Yeah.
the way you teach it or the concepts that are taught are different, because we have to meet the child where they're at and what their understanding is. But my fear is always that they take off with the physical piece and then get into trouble because of that mismatch in the physical versus social component too. And so I
Mhm.
understand this parental desire to protect and make sure, like,
Yeah.
well, it's kind of like, well, if I teach them this now, does that just mean it's going to start these behaviors they didn't know about before? And I'm like, they're probably already doing it. They're probably already experiencing it and feeling it or hearing about it or seeing it. And so if we can go ahead and start to educate and help give the child the knowledge and the competence, then our hope is that we won't run into some of these barriers when they're young adults. And then, after you turn 18, it's really scary the kind of trouble you can get into, especially with a minor or the
Yeah. And it doesn't and being conserved does not protect you in that regard.
right, right.
And I think that that's also a misconception.
Mhm,
Is that a conservatorship is going to protect my adult child from getting into legal trouble with this, and it doesn't.
mhm.
And so, that these are it's real, like reels with a Z reels, like it's
Yeah,
real. Um, yeah, and I do appreciate this idea that anxiety and worry are
yeah.
informative,
Mhm,
and so how does the parent also understand that the function of that for themselves, and what then is the antidote for that? It
mhm,
is then in education,
mhm.
of everybody, of the
Yeah,
system, right?
absolutely.
Or maybe even, Jamie, um eh, being able to use a framework, a structure in which to understand this, not only
Mhm.
for the young adult, but for the family as well.
Absolutely.
I see that from a self-reflective standpoint, and because so many of my clients struggle with introception, right? And I
Mhm.
want them to reflect on themselves. This is important in order for you to evaluate your own behavior,
Right.
see a future self, maybe. What are your goals? How do we get there? These types of things. And I
Mhm.
always find that what's so helpful is a formal process of helping a young person know who they are and what they want and how to get it. Um, of course, appropriately.
Of course.
But that I think sometimes that's what these groups offer. It's a framework,
Mhm. Yeah.
right? And so it takes away the feeling of overwhelm, I think.
Yeah, I think so too. And I know you had asked too how we incorporate parents, and I guess I kind of went off too, but we do, for the current group we're running, we have an optional caregiver component too.
Mhm.
And where we tell parents, we're not going to tell you what your young adult has shared with us because this is their space and their time. But at least we want you to know here's the topics we've gone over,
Yeah.
and then just give parents honestly a chance to support each other and just feeling uncomfortable and
Yeah.
talking about this, feeling worried and concerned. I think parent support groups are fantastic if any
Yeah.
parents are kind of looking for that. That's a great place and space to be able to share some of your concerns and worries because, for a lot of our parents, yeah, it is this um, desire to help but also protect that can be really conflicting. And I think with sex in particular, it's really scary. It's for any parent, it's scary, I think. And then
Yeah.
add on having, a developmental disability or social difficulties, and it
Yeah.
just triples the anxiety around it too.
Yeah, I mean, parenthood is paradoxical.
Yeah.
I mean, you are empowering and supporting your child to separate from you.
Mhm. Mhm.
And it's just one of those through connection, like
Mhm.
you're empowering them to leave you through connection. Like, huh? Like
Yeah.
that is, to me, parenting is a really so complex.
It is.
And it's not a simple task by any means. And that every parent has their own journey, their own family
Mhm.
values, their own place where they came from and why they make the decisions they make. And I think the minute we step into their shoes and we understand those pieces, we can see very clearly why those decisions were made.
Yeah.
Um, so it's really about, this idea of being able to have, for parents as well, no shame about the decisions they've made. And
Right.
so, I've a lot of parents that say, "Oh, this is my fault, Gwen. This is my fault. This is why they can't do their own laundry. This is why they don't know how tall they are. This is why, and I'm like, okay, like, it's okay. It's totally okay. What's the next step then?
Right.
Like,
Right.
and it's really kind of inoculations, little steps, we just need consecutive little wins. That really I think make the big difference over time because so
Yeah.
much of this becoming an adult is big.
It
It's
is.
overwhelming. Having your child like two parents, they've been doing this all their child's life.
Mhm.
And for
Mhm.
some parents, this was their primary identity.
Mhm.
And now their adult child's leaving. What does that mean? I anyway, I just feel like all of these pieces are related to this piece.
I agree, Gwen.
Just because this is part of becoming an adult is
Yeah.
this understanding.
And I think for parents too, it's acknowledging and accepting when you might need help. Like, it's not necessarily the parent's role to teach sex and sexual experiences. I mean, I always say the biggest thing you can do is provide an environment that's shame free, but not every young adult wants to talk
Yeah,
to their parent about this. And maybe it's identifying someone who they can speak to, whether it's one of these groups or it's a therapist or a trusted mentor or a trusted family member. I always say beware of the big sibling.
yeah,
The
yeah,
older
yeah.
sibling can sometimes be really helpful, but let's make sure we know what the older sibling is teaching too. So it might be that finding another space for them, but at least saying like, hey, I want you to have a place to talk about this that you feel comfortable. And that to me is also saying like, I want you to be able to explore your identity and to figure out what works for you and to
Hmm.
have healthy sexual experiences and romantic experiences. And if I'm not the person you feel comfortable talking to, let's find someone else.
Yeah.
Because I think this is really important. And I think that acknowledgement too is helpful. Of sometimes, you know, extra support is needed, and that's perfectly understandable and normal.
Yeah, absolutely. Yeah, so normalizing that process, right?
Totally.
Which is
Yeah.
so great. I love that idea of, as a parent myself, of saying, I'm not the best gal for this
Mhm.
job, but it's so important that we need to find someone or a
Mhm.
space for this to happen.
Mhm.
And again, that goes back to self-knowledge, but of the parent of themselves. And that is this is why parenting is so wonderfully complex, right?
Mhm.
Jamie, really quick, we were talking about the age
Yeah.
in which sex ed um not, I don't want to say should happened, but it kind of maybe approximating when should this idea, concepts, these concepts, when should they be introduced in your experience?
Yeah, I mean, I think it's somewhat individualized, but I think it's important to think about when puberty is occurring
Yeah.
too. So, thinking about when these physical feelings are really starting to emerge is important. But even, I mean, I've worked with parents who have said that their young child, like 2, 3 years old, either male or female, is kind of touching themselves, exploring
Mhm.
themselves. And so, in that sense, I'll say, let's not shame them, let's not say no, you can't do that, but let's at least find a space where they can do it, whether it's like in their bedroom or certain times. We just want to make sure that it's safe, because my fear of saying don't do this, no, is we're giving the message of like that's wrong. And what we're really saying is actually there's an appropriate place and space to do this. This just
Yeah.
isn't the appropriate place. And
Yeah.
so I think, um, ongoing support and ongoing conversations are helpful. But I think, particularly in that like adolescent, puberty range, is really important to start addressing this. I mean, when you think about when sex education classes occur within school systems, it's usually like that middle
Yeah.
school.
Seventh grade, sixth, seventh grade. I mean, it's
Yeah, sometimes
already,
even 5th, 6th grade,
yep.
yeah.
Yep.
And so, like I was saying earlier, you kinda have to figure out, what we're talking about with young adults is very different than what we'd be talking about for our, like, 14 to 16-year-old
Sure.
group. And
Sure.
that's important too, and I always wanna make sure parents understand that as well,
Yep.
that there's a difference in, like, the developmental level of the child too. Um, so I think that, like, adolescent age range. I'm also just thinking, going back to an earlier question you had, is like, how do we teach these concepts? We also want to think about even those individuals who have received like sex education, who may have autism or another developmental disability. Think about what kinds of accommodations they're already receiving in the school. Sometimes they're
Mhm.
receiving more visuals, right? Like oftentimes we see that visual nonverbal as opposed to verbal information is more helpful. Or checks for understanding, the ability to, someone's reading them the passage and then they're answering it verbally rather than writing it down. Just all these little like
Yep.
accommodations. And so thinking about, well, are those accommodations also being provided within the sex education group as well within the class? And so we try to incorporate those kind of components too into any group that we might lead. Like, we're really trying to incorporate visuals. We're not going to just talk about this concept. We're going to show a video of it. We're going to show pictures. We're going to label it. We're going to watch something in the media that's relevant to it. And so,
Yeah.
really trying to, again, just like this concept of bringing it to life,
Yep.
but then also making sure that they're grasping the concepts too in
Mhm.
a way that's digestible to this population. And
Yeah.
so I think regardless of when you start, it's making sure it's not just sitting down and saying, hey, Johnny, I want to talk to you about the birds and the bees. It's really like using visuals, which can be uncomfortable, but
Mhm.
I'm using visuals to really show like this is how it works. I mean, sometimes we have, actual models, like models of anatomy, or again, we're using, since we're virtual right now, we're using a lot of just pictures where we're showing things. And so I think just incorporating that too as a means of checking for comprehension is really important, and making sure it's not just let's sit down and talk about this, because then it's just blah 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 blah.
Yeah. It's like Charlie Brown's teacher.
Exactly,
Like,
exactly.
yeah, it's just a lot of want,
Yeah, that's exactly
talking.
what
But
I'm
that
thinking.
checking of comprehension is like so critical.
Yeah.
Um, because the misunderstandings can be very interesting. And that's what I catch. I catch because I say, whenever one of my clients is taking a workshop or something, a dating workshop or a sex
Mhm.
workshop or something, I'll say, hey, talk to me about it. Like, tell me all about it. What did you get from it? What do you remember? And
Yeah.
I will tell you, most of the time I have to make a correction.
Yeah,
You know,
I
because
know.
it's like,
Such a
"Oh,
misunderstanding. Yeah, if I go to a
yeah.
coffee shop, that's how I meet someone. It's like, "Oh, there's so
Oh,
many other components to this." Yeah,
there's like
exactly.
50 steps in between." But,
Yeah,
but it's okay. And it's okay because we gotta start somewhere.
Totally.
How many, so Jamie, talk to us about like kind of the nature of your group. Like how often do you guys meet and like when do you guys accept new people? How does that work?
Yeah, so our group is currently run through the help group through a program called AdvanceLA, which is for young adults with autism, other developmental disabilities. We have quite a few programs. We have a parent support group that's actually free, which is great. And then some other, like movie nights and karaoke and other just kind of meetups. We actually also just started dating coaching. So some of our coaches are working on things like executive functioning skills and finances, we've realized there's a need for this too. And so we started some dating coaching too, just kind of around that social component. But the group specifically that I'm running, we're in our 5th week. Right now, we're not currently accepting anyone else since we're already in our 5th week, but we try to keep the group relatively small. We have no more than 12 people at a time. We're all virtual right now. And actually, we've talked about even when we go back in person, we might maintain a virtual presence because what's really cool about this group is we have individuals from all across the country currently who have joined, which is
I was
really
going to
nice
ask you
and
that
fun
question. That's
because
awesome.
someone in Ohio is now friends with someone, making a connection with someone in California and New York. It's really been great to see. So we are planning to continue to run these groups. We've had a really great, response and turnout so far. As I mentioned, we're running this current curriculum in collaboration with Dr. Crehan at Tufts. And so every week we're asking the participants, did you learn something new? Was this relevant to you? Would you want to hear more? And doing a few like pre and post measures just so we can really figure out like, was this a good curriculum? Did the adults actually learn something and will they actually apply that rather than just like you were saying, here, take this group and then we'll see what they do with it. So we want to make
Yeah.
sure that it's actually useful information that they're gaining. And then we plan to adapt that and continue to run these groups. So I would say if anyone's interested, they can either go to the Help Groups Advanced LA website or even contact me directly. I'll give my contact information. Is it best to say it or do you have like a
Yeah,
way to
I'll put it in the description. I'll get it from you,
perfect.
Jamie, and I'll put it in the description of the
Yeah,
video
and
and people can look there.
families can email me directly, and we have a little wait list right now for the next group. We might do an adolescent group and a young adult group because we've had quite a few people who are interested. So it's a 16-week group, which means
Okay.
we have a little bit before we'll start the next one.
Yeah.
Um, but we are fully planning to continue this, and we've even talked about, this was a suggestion for some of the parents and the adults themselves is once they finish the group, can they continue in kind of like a peer consult group where it's like more of a
Mm.
support group where like now we've
Yeah.
learned everything. Let's continue to talk to each other weekly so that we can, bounce ideas off of each other and, hey, this happened. What does this mean? And so it's been really great to see that piece come to life too, which was something that we hoped but weren't sure of. But it's been really nice to see that this is not just, again, I always think about a woman who's like, here's the penis. Like,
Yeah. Yeah. Totally,
that's the
totally.
whole video in my mind. Yeah,
Here's a picture from 1970.
exactly,
I mean,
exactly.
I
Truly,
mean, you've seen a lot of that material, so I'm
truly, and it's not very LGBTQ inclusive either. So we've really tried to adapt it and make sure we're using a curriculum that's more, more progressive and modern. Um, but yeah, I mean, we plan to continue to run groups, and like I said, maybe some of these individuals will stay connected through more of like a consult or
yeah.
support group, I should say.
It's awesome. I mean, I
Yeah,
think to talk about what they've learned in application.
exactly,
I mean,
exactly.
that's where like the rubber's meeting the road and things are happening. You're like,
Yeah.
whoa, and to I think there's such power in peer support. Because so many times our clients are supported by adults, older
Mhm.
adults, all their life. And they never get that peer to peer kind of support that is so critical developmentally. And that's what they really want. They
It
want
is.
friendships and they want
Mhm,
relationships
mhm,
with their peers.
mhm.
So I love that. Okay, so Jamie, I end all of my interviews this way.
Okay.
If you could only choose one skill to empower, what would it be and why?
I love this question, Gwen. Um, okay, only one skill. My gut says self-confidence.
Mm,
I think that's such an important, especially thinking about this young adult population. I feel like that's such an important skill. I think having self confidence also gives you the ability to use your other skills well, right?
yeah,
So
yeah,
if I'm working on anxiety with a client and they have the tools, but they don't have the confidence to use those tools, it doesn't really work, right? And so just thinking how important it is to be confident in yourself, goes with being empowered, right?
yeah,
Being able to make decisions and feel like they're the right decisions, or being confident that if you messed up, it's
yeah.
okay that I messed up. I think that's
Yes.
the biggest thing that I would love for every client to have.
I love that. I mean, I really do. When we think about self-confidence, self-trust, right? Like I can trust myself, and I trust myself to know how to apply something or when I might need help. You
Right.
know, the
Great.
when I might need a consult with someone else because I need to solve a problem. Whatever that is, comes back to this idea of self-knowledge
Hmm.
and self-awareness, but it also comes back to just plain old skills.
Hmm.
Like, I feel like self-confidence is really built on the truth and the foundation of the conversion of skills.
Yeah. Yeah.
When I have the skills and I use them over and over again, I know. I know I can do those things. And
Right.
that's another reason why I love chores. I love a lot of chores early on because you give kids responsibility and they practice, and by the time they're adults it's like, wow, I can actually take care of myself and the place that I live, and like,
Feels
right,
good.
it feels good. And
Yeah.
so um I just, yeah, I love that. We could probably have a whole nother interview
We
about
could.
self-confidence.
We could, because I think there's also a misconception that self-confidence means like
Arrogant.
you always do everything right, right?
Uh-huh.
Like,
Oh
no,
yeah.
that's not what we're saying. We're saying you mess
Yes.
up,
Yes.
but you have the confidence and the trust to get the help you need. And
Yeah.
exactly, I love that you added that piece of it too.
Yeah. And it doesn't mean you're arrogant either. Like,
Right,
that's
right.
another thing. Like, I'm always, like when I'm defining words with my clients, independence, for example, for so many of my clients means alone. It's like, no,
Yes.
it's not
Oh,
alone.
yes.
So they don't want to be independent. I'm like, I get
Yeah,
it. If it meant alone, I wouldn't want to be
yeah.
independent either, right?
Right.
But self-confident for so many of my very sweet, polite, respectful clients, they're like, I don't want, why? Oh, because then I'm cocky. I'm
Yeah.
arrogant. It's like, oh, it's not that. And I think the other piece that self confidence does is it allows you to take the necessary risks that
Hmm.
you need to take in life in order to grow and develop.
Yeah.
And that's just, that I think that's just part of being human, regardless of disability or not. But anyway,
I
Jamie,
agree.
thank you so
Thank
much for your time and
you.
sharing your talents and your expertise today. I really appreciate it.
Yeah, I'm happy to. I always say I'm always happy to talk about sex. So
Hey, why not?
right, exactly.
Thank you.
Thanks, Gwen.
Hey, thanks for watching. If you're interested in finding out more about Jamie, her information is in the description below. I've also provided a link to my website where I provide additional insights and impressions of this episode. If you got any value from this episode, please hit that like button and subscribe to this channel. Doing so helps to get this information to others just like you. I hope to see you in the next episode in this series, where Jamie and I talk about dating in a rubber meets the road kind of way. Take good care.